Diabetes is an endocrine disease that is one of the most common causes of death in Mexico. The disease is characterized by blood glucose, also called blood sugar, being too high. At this point, insulin starts its action. Insulin is an hormone made by the pancreas that helps glucose get into the cells to be used for energy. Sometimes, the organism doesn't make enough or any insulin, or doesn't use insulin well, so the glucose stays in the blood and doesn't reach the cells. There are two types of common diabetes, type 1 and type 2.
Type 1 diabetes occurs when your immune system, the body system for fighting infection, attack and destroy the insulin-producing beta cells of the pancreas. Also, scientists think type 1 diabetes is caused by genes and environmental factors, such as viruses that might trigger the disease. On the other hand, type 2 diabetes, the most common form of diabetes, is caused by several factors, including lifestyle factors and genes. Within the causes is overweight, obesity, and physical inactivity. Although the already mentioned causes of diabetes are the most common ones, there are other causes that could develop the disease. These include genetic mutations like monogenic disease, cystic fibrosis, and hormonal disease like Cushing syndrome, acromegaly, and hyperthyroidism. Diabetes type 1 or juvenile onset diabetes is an autoimmune disorder characterized by T-cell mediated destruction of pancreatic B cells, which result in insulin deficiency and ultimately hyperglycemia by several immune markers, in particular autoantibodies. On the other hand, type 2 diabetes, also known as non-insulin dependent diabetes mellitus or adult onset diabetes, in this type of diabetes is characterized by two main insulin-related anomalies: insulin resistance and B-cell dysfunction, which leads to a decreased response or sensitivity of cells in the peripheral tissues, in particular the muscle, liver, and adipose tissue toward insulin.
The latest estimates shows a global prevalence of 382 million people with diabetes in 2013, expected to rise to 592 million by 2035, with type 2 diabetes accounting for the majority. The results of a meta-analysis show that type 1 diabetes has a prevalence of 9.5% in the world. On the other hand, globally, an estimated of 462 million individuals are affected by type 2 diabetes, corresponding to 6.28% of the world's population.
Let's continue with the symptoms. The general symptoms are urinate a lot, often at night are very thirsty, lose weight without trying, are very hungry, have blurry vision, numb or tingling hands or feet, feel very tired, dry skin, have sores that heal slowly, and have more infections than usual. For being more specific, type 1 diabetes may also have nausea, vomiting, or stomach pain. Can develop just in a few weeks or months and can be severe. The type 2 diabetes takes several years to develop. Some people don't notice any symptoms at all. Now, clinical manifestations. Some people, especially if they have prediabetes, gestational diabetes, or type 2 diabetes, may not have clinical manifestation. In type 1, manifestations tend to come quickly and be more severe. Continue with the diagnosis. We have three. The first one is random blood sugar test. This is a blood sample will be taken at a random time. The second one is fasting blood sugar test. This is a blood sample will be taken after you haven't eaten anything the night before. And the third one is glucose tolerance test. For this test, you fast overnight. Then the fasting blood sugar level is measured. Then you drink a sugary liquid, and blood sugar levels are tested regularly for the next 2 hours. Now the treatment. Depending on what type of diabetes you have, blood sugar monitoring, insulin, and oral drugs may be part of your treatment. Eating a healthy diet, staying a healthy weight, and getting regular physical activity also are important parts of managing diabetes. Now, the treatment for type 1 diabetes involves insulin injections or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting. For some people with type 1 diabetes, pancreas transplant or islet cell transplant may be an option. The treatment of type 2 diabetes mostly involves lifestyle changes, monitoring of your blood sugar, along with oral diabetes drugs, insulin, or both. Well, we've reached the end of the video. We hope it has been useful to have clear information about what diabetes is, since it is a common disease in our country and thus raise awareness of the importance of its control and prevention.